I have to stand here so I can see what I was talking about. Don't walk backwards, okay? I won't walk backwards. Next. Okay, by the way, in case you haven't noticed, there's a lot of local colour in our team and stuff. It comes from my background. You see, I'm an Anglican, and when I was a kid on youth fellowship, I wanted to be bishop. Then by the time I went to secondary school and pre-U and university, or before university, I discovered I'm not holy enough to be even a pastor. So I really admire it. One of the other things that pushed me into psychiatry also was, I think that in our early training, I still remember going for church board meetings, and I admire pastors so much for being able to not only do the spiritual training, but for some strange reason we also think that pastors all have financial and other training to know how to manage all board matters. What I remember most in my growing up years was AGM, which lasted 6 hours. After that I went, we were friends with the senior pastor at the time. I went to the pastor's house, and he was there, and his wife was sitting next to him, and he was having an asthmatic attack. And I was a young doctor at the time, not yet a psychiatrist. I realized, wow, how stressful and how emotional these long meetings are, where you've got to focus all the time on answering people's questions. And wow, sometimes Christians also can be very cruel in their questioning and stuff. So anyway, I ended up as a psychiatrist. Long story short. It's longer than that because my dad was the first Asian sent by the Strait Settlements government in 1946 to England or London to study psychiatry. So when I share, usually I tell people that mental illness runs in my family. Okay, so we founded Promises Healthcare, and by the way, I really didn't want to come out into private practice, but I guess I had a lot of things where God talked and told messages quite clearly in ways that I had difficulty avoiding. At that time I was with Church of Our Saviour for a period. And Church of Our Saviour, Derek Hong's church, has a prophecy ministry, and all I remember was that I've been in the Anglican church for many years, 40-odd years at that time, and suddenly I have people coming and knocking on my back and saying, here's a piece of paper, God told me to tell you this. And in my mind as a psychiatrist, I was thinking, should I ask more? What God is you talking to? Anyway, all of them were basically I should leave and go out from what I was doing. So, okay. Long story short, we ended up set up Promises Healthcare. Promises is double meaning. There's the promises of God, but promises is also something found in all 12-step recovery, where 12-step recovery basically is addiction recovery, where you come to learn how to win your recovery and win your wellness by surrender. So it's a very Christian program. Step 1, you find out that I can't do it, I have a problem. Step 2, I believe that there is a higher power of God who can help me to do it. And step 3, I learned to turn my life over to that power. And so it's learning to surrender. And that's very interesting because in all addiction recovery, it is, and it's also for many other parts of life, the harder you try, or the more you want to say, I will do it, it's very difficult. But when you surrender, it says, I can't do it, but I know the power that can, so I'll trust that He will do it for me or help me to do it. And so it's learning to turn your lives over to God. This simple core values, which is compassionate people, passionate science, I must confess, was stolen from Beijing Hospital number 6. I was talking at a conference there in 2004, and I saw this, of course it was in Chinese, so I asked them what is that. So that time it was passionate science first and compassionate people. So that's what we try and put into all our work. We want to be a compassionate service, and but passionate about the science that backs up all this. So we were the first in Singapore to bring in things like RTMS or transcranial magnetic stimulation, first for a lot of other new things. In the next year or two, you'll see we'll be also in the forefront. And we've been blessed, not by our own doings, because we're not very sure sometimes what we're doing. But it happens and gets done along the way. To tell you how difficult it was, so in the first few years when Tanya and Daniel joined Promises, and you tell me that I always tell the story, Daniel comes from a missionary background in Papua New Guinea, but he came as my managing director of Promises. And it was very difficult because we just started a new organization, first 3 years. I asked him, so Daniel, do we have enough money to pay our staff for the next 3 months? And he looked at the paper and looked at the ceiling, and then he told me, you know, Muni, I'm not very sure, but don't worry, God will provide. And for a commercial entity, that was quite scary. Still is, by the way. Okay, so here's our services: general mental health, Visions. Visions is a Promises recovery treatment. And so we provide intensive outpatient care. 3 times or 4 times a week they come in and run groups. The child, adolescent and youth services have expanded so fast that since the beginning of the year we've had to add 3 clinics to actually provide the child and adolescent services. Family and relationship services too, for marital services, psychodrama, or experiential services. So sometimes it's very difficult for people to express what they feel. As I told you at Lexi time here this morning, people don't know what they're feeling. So sometimes by getting them out of the speaking mode, but getting them to act out things, they actually manage to share stuff. And chronic pain management, medical legal, we have ended up in a very short period of time, I think doing the most medical legal reports in Singapore for any practice. And then our EAP programs, which is for companies. Sometimes I wonder maybe we should add EAP programs, employee assistance programs to churches too. Okay? And then Promises events and training. I think this is added onto that as well. Next. This is just very briefly, we have 48, and this is out of date because now from next month there will be 6, and to be more psychiatrists, and there's more of everything there. Next. That's again just to show you what it is. Next. Hey!
Okay, it's pronounced as SALTCare, and the Christians have got no problem pronouncing it SALTCare, but any other people I talk with in the community, they keep calling us PSALT, alright? So I've just got used to it. So it's also started by Dr. Winslow incidentally. So inspiration is to be the salt of the earth, and P is for promises. So it just as well. Okay, so we are coming alongside to empower the church with the services that we provide to support the church community. And in this short presentation, I'm going to share of how we are. There's a shared faith and common mission, which is empowered by the Holy Spirit. We'll share about the services that we provide and the groups that we serve. We, in the whole mental health community and every social service agencies, we pretty much try to avoid duplication so that other services that are already covered by other agencies we avoid. And we'll share with you what the key tenets of our faith. We are particularly strong in the area of peer support groups. We believe that there's a lot of wisdom, and we'll share a bit about Betty's place for peers. Okay, peers, sorry. Thanks, Pastor John. So what we do is that for persons with mental health conditions, we refer to them as peers. in the sense that across the room, all of us have different issues that we are struggling with, that we are coping with, and in very real human level, we identify with them in a very meaningful way in what we call their journey to recovery, because all of us at any one point in time, and if you see the statistics, 1 in 7 of us here have a serious mental health condition that requires intervention, and in this group here of almost 200 persons, you'll find that at least 30 of you probably need some help from professionals. So, okay, so we are a relatively young charity, started in 2014, and we got IPC status, meaning as an institution of a public character, 2018. We operate out of Hougang area, Jalan Lepas, and we're very blessed indeed for a very small and very young charity that we are officially opened by President Halimah Yacob in the middle of the pandemic. And we are a secular charity, but we are truly guided by Christian values and principles. So that was the inspiration behind the leadership of PSALTCare. Is simply in a nutshell, we just want to heal the brokenhearted and proclaim liberty to the captives. And we do it through secular means, we do it through support groups and so on. So our mission is to enhance and sustain the well-being of persons with mental health, emotional, addiction challenges. And one of the few things we hope to do is that by coming to support groups and the things that the services that we provide, persons with mental health conditions don't have to keep relapsing, that they don't need to go back to IMH. Then they can, through their lived experiences, when they get stronger, then they can share with the community and eventually reintegrate into society with meaningful employment. So, to help people understand the full range of services that we provide here at PSALTCare, we use the letters from our organization, PSALT, to really give a nutshell understanding of what we actually do. So peer support, we conduct peer-led daily check-in groups, which started in 2020, the daily support group, which means that every day from 12 noon to 12:45, we are running support groups Monday to Saturdays, including public holidays, including New Year's Day, Chinese New Year, I think including Christmas Day. So every day, Sundays, we leave them off to the churches to get a dose of encouragement. And we run weekly evening support groups every Wednesday. And there's this program called Aspire program, where we actually have peer support specialists to journey with individual peers to achieve their wellness goals over a 3-month period. So meaning we ask the peers, what are the 3 things you want to achieve over the next 3 months? And we journey with them in terms of their mutual goals so that they can see the progress. And the key difference that we do is that we don't require formal diagnosis, because we do understand that there are people who are quite averse to getting themselves formally diagnosed. But if they suspect or they realize that they are going through a season where they have some depression or anxiety issues, they can dial in and join our support group. The second thing that we do is advocacy, where we conduct public education talks, whether to school, institutions, or even church groups, to educate a little bit more about mental health condition, so as to minimize the sense of stigma in the community, and also part and parcel of equipping the community. So life skills, equipping peers with relevant competencies to integrate to society. And we use this framework called 10 dimensions of wellness, which is actually formulated by the Institute for Wellness Education, to realize that there are 10 different dimensions that can affect your wellness, whether it's the area of physical health, the area of nutrition, even the area of financial wellness. Because any of these things, which when they are out of sync in a person's life, it can truly have an adverse impact on a person's overall mental health well-being. So this is what we actually go through in terms of providing some life skill training to our peers or those who register with us or sign up with us so that we teach them all this. As well as the therapies, we provide them workshops as well on therapeutic approaches like DBT, and so on. And also we do provide counseling sessions for some who need one-to-one support. We have volunteer counselors who work with us and who support us, and we provide one-to-one counseling as well. So these are the groups that we serve. People with persons with depression, bipolar disorders, anxiety disorders, OCD and psychosis. So for those that are not listed here, generally we refer to other agencies whom we know are already supporting those groups. So the key tenets of our service is we believe in the power of support groups, peer support. And you'll find that persons with mental health conditions generally feel inferior, they feel stigmatized by society. So what we are actively trying to convey the impression and that belief that a peer is a provider of empowering effective resources for recovery. Is that when you have gone through a season of challenge and when you are stronger, you have a set of lived experience that can benefit the community, that someone who has not gone through that lived experience will not be in a position to do so. So it is the premise that there's a rich pool of wisdom and lived experience, even while we recognize that wisdom comes from the Lord. And we are peer-led, peer-driven, so all the services are all led by peers, and as an organization, we live and we walk the talk, meaning that as of now, 50% of our staff, full-time staff team members are present with mental health conditions. And they are not just doing simple, mundane job, they are actually holding key positions of leadership in the organization. And we support peers holistically through their long and non-linear recovery journey. And what we do recognize is that recovery is not a straight line. It doesn't mean that exponentially they'll get better year by year, but there are sometimes they get back well, and then there'll be a season they plunge again and go up, and we live through that. And we have launched the Aspire program, as we spoke about a moment ago, and through 10 dimensions of wellness. So the whole idea is to help them truly live an abundant life as Christ has promised us. Okay, and this is just last month's calendar of activities. So as you can see, every month, every day of the week, there is something happening at PSALTCare for the benefit of the peer community. So we also have place where it is our hub, Betsy's Place we call it, and this is the line drawing of the place that we have at Jalan Lepas. Betsy's Place is a place for peers by peers, where we run support groups, all the activities, as well as a short-term residential respite care for persons to get into a place of wellness. So we are pretty much, very much Christ-focused, Christ-centered, and taking our service model through the life and the service of Christ. And we trust that the services that we provide is something that you could tap on and how we can come alongside you. So if there's any question you can ask, you'd like to ask, you can contact me, and that's my email address there. So I'll end my presentation here. If there's any questions you'd like to ask us, I think it's time